are going to start our next session. Sorry, we don't have chairpersons for the discussion. We have just the presenters. So I shall be presenting a case of bone in the eye, a rare case of choroidal osteoma involving the macula. Choroidal osteoma is a rare benign ossifying tumor of the choroid, first described by Gass in 1978. It predominantly occurs in healthy young females in second or third decade. It is located in the juxtapapillary or peripapillary area, mostly unilateral with unknown etiology. Patients are usually asymptomatic. They may have mild to severe blurring of the vision, metamorphopsia or visual field defect corresponding to the location of the tumor. Presenting a case of young 18 years female, she complained of blurred vision in the left eye for 2 months. She had no history of systemic illness or trauma. Her best corrected vision was 20/20 in both the eyes. Anterior segment exam was normal. Right eye fundus was normal. This is the fundus photograph of the left eye. We can see a mass involving the posterior pole, yellowish orange in color, and the retinal blood vessels running over it. It means the mass is subretinal and it has got well defined margins. The lesion was hyper on autofluorescence. On OCT, the retinal layers, they were raised somewhat, means the lesion is subretinal. This is the angio. In FFA, in early phases, there was patchy hyperfluorescent lesions with diffuse staining in the late phases. B scan was diagnostic in this case. There was hyperechoic area with the anechoic area beneath it, and the size of the lesion was 10.69 millimeter, and it gave the appearance of pseudo-optic nerve. So we made a diagnosis of choroidal osteoma. So these things we kept in the differential diagnosis, could be amelanotic choroidal melanoma, choroidal nevus, metastasis, hemangioma, disciform macular degeneration, posterior scleritis, idiopathic sclerochoroidal calcification or choroidal cartilage. These are the few features of choroidal masses. So B scan is very diagnostic in choroidal osteoma. Patients, they are usually asymptomatic, but choroidal neovascular membrane can develop, and multimodal imaging always helps to differentiate from other choroidal masses. So to conclude, choroidal osteoma is a rare benign ossifying tumor, usually juxta or peripapillary in location. Macular involvement is rare, as in this case, since the macula was involved but the vision was 6/6. And B scan is very diagnostic. Early diagnosis of choroidal osteoma helps to keep the patient under close follow-up for the detection and treatment of complications like choroidal neovascular membrane.